I'm a family physician in Fort Collins, Colorado, CEO of Miramont Family Medicine, which is a network of patient-centered medical homes in Colorado. We're a Level 3 NCQA recognized patient-centered medical home. Back in 2007, my partners and I realized that we weren't really doing anything differently than we had been doing perhaps 10 years earlier. We were still in paper by and large. We didn't have a good handle on our metrics, had no idea how many of our diabetics, for example, were at goal. And we decided that we had to get out of last century and start building for the future. And I believed, as did my partners, that the process starts with investing. We basically put together a proposal, invested about $134,000 that first year, and cumulatively about $250,000. And from that, we improved our safety, our efficiency. So we were perfectly positioned then to do meaningful use on the margin, if you will. Most of what was required, we were already doing. We were already e-prescribing. And so our incremental costs to do it were not so great. And I would suggest that doing an improvement project with electronic health records simply to get meaningful use dollars is not a good strategy. There has to be a plan to improve safety, to improve efficiencies, to change workflows in the practice, and that's really where a practice gets their big returns, and then the meaningful use is just the frosting on the cake. Implementing an electronic health record changes workflows. We're ready for the change, and we see it now more as progress and something to look forward to. And so we're excited about deploying patient self-checking kiosks, for example, next month, which are going to improve our efficiencies, and being able to implement technology in a way that gives us a competitive advantage in the marketplace. Well, it starts with having a PACOS number assigned through the CMS website. And then once a physician is registered, which basically says, look, I'm going to do this, they have to start collecting data. Now, there's a lot of different ways to collect data. Many EHRs purport that they have registry functionality. After 90 days for stage 1, we had our data and we were able to go to the attestation phase. We did that in April of 2011, and then we were promptly paid about 30 days later $18,000 per physician for stage 1 meaningful use. It really rewarded us well. I'm in an economy where we had 34 primary care doctors shutter their doors in the last 8 years. 8 of those were actual bankruptcies, and the number of emergency room physician beds, the number of emergency room beds increased by 100%. The number of emergency room physicians increased by 50%. So basically, more and more people were going to high-cost centers to get their health care at a later stage of their illness. And yet, while that was all going on, our practice was able to grow from 1 physician and 1 computer to 14 providers, 4 locations, about 50 employees, over 80 computers working in a centralized data center, and about 27,000 patients. Well, there's 2 things I tell physicians. They need leadership and they need courage. First, they have to go to their practice and tell them, look, we're going to do this. And they need to make certain that everyone is involved at the team level. If the physician tries to do it by themselves, it's not going to work. If the physician tells their staff, look, you guys make this work and let me know when you're done, that's not going to work either. There definitely has to be coordination and a commitment from everyone in the back office, the front office, billing, what have you, to pull this off. There has to be some resolve. People have to believe that they're going to be able to do it and commit to maybe 1 to 2 years from the time they get their EHR before they're going to be at that level of performance. But they're going to have a lot of other benefits along the way before they get the incentive monies, including those workflow enhancements and improvements in efficiency. The second thing they need is courage. And a lot of times physicians are hesitant to do things because they feel that they need to be cautious. And the opposite of cautious, however, is not always careless. Sometimes the opposite of cautious is courage. And physicians need to ask themselves, are we not doing this because it's careless or wouldn't be prudent? Or are we not doing it because we're kind of afraid and we're not willing to take the risk? And I would say this is the time to take risk if they want to evolve as opposed to being extinct. trying to get patients to change their behaviors as well is an ongoing challenge, just as when we try to get them to quit smoking or to lose weight. But we found it very helpful to have some care coordinators, to have some health coaches, and so we've used some of our incentive monies not just to pay for the IT, but also to help make certain that we can do the care coordination piece that comes with the ability to use the tool at its maximum effect. And that really helps get the patients to buy in to the process. Many patients are aware of what we're doing. For some of them, it's probably below the radar. But for those who've seen the awards or know what Miramont's been able to achieve because they've been with us for 10 years and have seen the transformation, they're pretty proud about it. One of the tools I use, again, is the patient portal. So I invite patients to log online to our website, miramont.us, to look at their electronic health record. Sometimes patients come back and they say, well, I saw this diagnosis and I don't have that. And then we go back and we look, and it turns out maybe that was a working diagnosis from a year ago. We can delete it from their chart. And as patients see that now they have some control over what's in that medical record, so we've gone from the old age where the physician is sitting there with the pad, well, Mr. Jones, tell us what's going on. And we can do that with the computer too, right? I can sit there and type, and the patient still doesn't know what's going on. We turn the screen, we let them look on, we show them what we're doing, we value the technology in the workplace. If the computer's a little slow, I don't badmouth it in front of them. Make eye contact with the patient, not just with the computer screen. And over time, they start to realize that this really is a fantastic tool that gives them more power over the data as well. Probably the most rewarding part of it for me was knowing that we were making our practice, our community better for our patients. In order to maintain relevancy, we had to get into this century. We had to get out of paper. We had to start being able to utilize the new technology the way other industries have. And in doing so, we've created patients that are healthier, an environment that's safer, a workplace that's more efficient so that staff are happier. It's easier to retain staff.